Good day everyone, my name is Kusha Maria Pelga from SAS Iloilo Batch 3. Today I'm going to perform oxygenation through cannula and face mask. So the rationale for doing this procedure is to deliver an oxygen gas so that it will help the patient to breathe. The patient also can receive oxygen therapy from tube resting on their nose or by face mask or a tube placed on their trachea or a windpipe. So prior doing all of the procedure, first we need to verify the doctor's order. The rationale is for us to be sure if we're doing the right thing or if we're giving an appropriate procedure to the patient. Next is we need to prepare all of the equipments that we will be needing. So for this procedure, we need to have a simple face mask. Next is the cannula or the nasal cannulate. And then next, of course, we also need to have an oxygen equipment such as this oxygen tank together with humidifier and the flow meter. Next, we need to perform hand washing technique. The rationale is to prevent the spreading of microorganisms. And we also have to identify the client and explain the procedure. The rationale is for us to verify if we're handling the right client and of course in order for him or her to have an awareness what we will be going to do or how he or she can cooperate. Next is we have to provide privacy all throughout the procedure. The rationale is in order for the patient to be comfortable while doing the whole procedure. So now I'll be setting up the oxygen equipment together with the humidifier. So let us assume that this is now the oxygen equipment together with the flow meter and the humidifier. So the first thing that we have to do is to attach the flow meter to the wall outlet or a tank. So here is the flow meter. So we have to attach it on the wall outlet or the tank. So let us assume that this is now attached. Next is we have to fill the humidifier bottle. Here is the humidifier bottle. So we have to fill it with the distilled water if needed. So let us assume that it is now filled with distilled water. Next is we have to attach the humidifier bottle to the base of the flow meter. So let us assume that it is already attached. So here is the humidifier bottle and it is the base of the flow meter. So we have to attach the humidifier bottle to the base of the flow meter. So here we'll attach what is prescribed oxygen tubing or the delivery device. So after that, we have to turn on the oxygen to the prescribed rate and make it sure that it is flowing correctly. We have to check if the oxygen is flowing through the tubing and then set the oxygen at the flow rate as ordered. Then we will now apply the appropriate delivery device. So we're using a cannula or nasal cannula and a face mask or simple face mask as a delivery device. So firstly, the nasal cannula, in using this kind of oxygen therapy, the patient is able to eat, drink, and speak because it is a lightweight and also it is much more comfortable for the patient to wear. So before doing that, we need first to introduce ourselves to the patient. Good day, Mom. My name is Kusha, your caregiver for today. And today I will be putting a nasal cannula and a face mask to you. Is it okay to you, Mom? Okay, great. So first, the nasal cannula. So in doing this, we need to put the cannula with prongs downward. And we'll put it on around the patient's head. And the elastic band should surround the ear of the patients under their chin. So if the cannula cannot stay in place, we have to put a tape on the face of the client so that it will stay in place. So we're done now on the nasal cannula. So let's proceed on the face mask. It is often used on the clients who has minimal respiratory distress and usually used for mouth breather patient. So in doing this, we need to put the mask on the client's face and attach it on the nose and downward. So this is a simple face mask. So next, we have to feed the metal here. This is the metal on the nose of the patient so that it will contour the face of the patient and she will be comfortable. Next, we have to secure the elastic band so that it will not move and it will fit. So next, we need to pad bands behind the patient's ear so that it will secured. And there is a tubing there so that it will connect on the humidifier. So after doing all of the procedure, we have to assess the client's vital signs, also the level of anxiety and the color. When the procedure is done, we have to aftercare all of the materials that we used and then document all the procedure that we've done. Thank you.